All right, ta-da. Hey y'all, hey, happy Monday. How's everybody doing? I am logging on at 8 o'clock sharp for my Monday moment. Y'all should know by now. If you don't, I do this each and every Monday. I ask you to have a moment with me, your girl, Mojo, and usually a lovely, delightful guest. Today's guest is Dr. Sultan Sims. He's so gracious to bless us with his presence today. So thank you and welcome.
Thank you. Thank you. Happy to be here.
I see everybody joining in. I'll give y'all a couple few seconds to join in, and I will tell you today's moment is about mental health awareness. So, the lovely doctor that's in the house is going to share with us some little tidbits of how he got started, his journey, what he's doing now, and some tips we could do to help ourselves be aware of our mental health and also become less stressed if we're paying attention. So I'll let people start joining in. If y'all don't know what finding your mojo is, finding your mojo just means how you show up as your authentic self and whatever it is you are doing in life. If you're working, if you're playing, if you're shoveling snow in the Northeast, if you are doing your homework, any of the things, just showing up and being yourself and whatever it is that you're doing. Because Maisha is different than you and she and me. So you just want to make sure you're doing what you're doing as you and showing up as yourself and not somebody else because we were all blessed with our own individuality. So that's what we're trying to do today. So welcome y'all. I see you BK to LA. Hey mommy. Hi Sabina. Hi Sunshine. Hi Barbara. Thank y'all for joining us on another Monday at 8 p.m. Today's topic, if you're just signing in, is about mental health awareness. So thank y'all for joining. If y'all don't know, I do this each and every Monday, 8 p.m. IG at Mojo295 or on YouTube at FIM with Maisha. I usually start the hour, which I will do today as well, with a lovely little cocktail or mocktail, which is today's instance. Because what better conversations are had than with a nice little fellowship, a little libation. So today I'm going to make a little mocktail. I like a bubbly. So I'm going to do some tart cherry juice that I was happy to steal from mommy upstairs. Some sparkling bubbly, because as I mentioned, I like bubbly. And just some ice and a little orange wedge, because you got to garnish your drink, because that makes me happy. So I'm going to put mine in a wine glass, because it's the right thing to do. Y'all feel free to join in the fun. What you drinking over there, Doc?
Just water.
Just
I'm a whiskey guy, but I feel like, being a doctor talking about mental health, now's not the time.
You might want to be in the right mind.
Now's not the time. I might tell y'all, be mindful with your alcohol consumption and, all of that. Everything in moderation.
That's right. That's right.
Yeah.
Now, if y'all want to, y'all like it a little sugar, y'all stuff. You could put a little agave, a little honey. But I'm just doing straight up today. I'm gonna just do some bubbles and some tart cherry. I hear tart cherry is good for you too. I'm just saying. And I'm gonna garnish mine with a little orange because that makes me happy. I should also say happy Black History Month because it is still Black History Month. Yes. So power to the people. And it is Heart Month. So happy Heart Month. Cheers to the love. Happy Monday, y'all.
Cheers.
We could use a little agave though, I'm not gonna lie. Anyway. All right, now that we got the libation out of the way, y'all, thank y'all for joining me for another Monday moment. If it's if you've been here before, and if you haven't, welcome to your first Monday moment. Thank you for joining. I am blessed to have the lovely doctor in the house, Dr. Sultan Sims, who is going to talk to us today about mental health awareness. So before we get into the questions, can you just introduce yourself to the people, tell them a little bit about yourself, who you are, where you are, what you do? And then we'll dig in.
All right. Well, I'm Dr. Sims. I'm a psychiatrist. I'm originally from New York. Grew up in Queens, New York. Went to Catholic school. We were just talking about Lent. I went to St. Anthony's out on Long Island, and I went off to college. I played a little ball. I went to Yale University. Finished up there. Went to medical school. A lot of people ask about the path to becoming a physician. So you got to go to college, typically 4 years, might take a little longer. Then after that, medical school is another 4 years. During my medical school years, you got to pick your specialty. I fell in love with psychiatry. You get exposed your third year to all the different clinical specialties. So fell in love with psychiatry, luckily for me. Then I went on to my residency training. I went back up to New York to Long Island Jewish uh, Hospital. It was called Hillside Hospital back then, where I trained. Northwell is the name of the system now in New York. And then once I was done in '05, I came right back down to Atlanta. I fell in love with Atlanta when I was here at Morehouse School of Medicine from '97 to 2001, and came back. So yeah, that's my journey down to Atlanta. My first job. So I've done clinical work. Currently, my main gig is a managed care job. I see patients virtually. Since the pandemic, that really has exploded, and psychiatry is really well positioned to use technology. We're not laying hands on people like other medical specialties. So I do that, and I do some supervision of nurse practitioners as well. So yeah, been completed my training in 2005. So it's been over 20 years.
Oh wow, I was just gonna ask you that. How long has it been?
Yeah, been over 20 years. I'm blessed. I'm lucky. I'm just happy with what I do. I enjoy what I do, and we'll talk a lot about it, but there's so much you can do in psychiatry. Um, so I'm never bored.
Oh, that's a good way to be.
Yeah, 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 for sure, for sure. It's when I say I fell in love with psychiatry, like during those rotations in medical school, you get your first opportunity to interact with people who are maybe struggling with anxiety, depression, schizophrenia, bipolar disorder. You read about the conditions, and it's like, wow, like, is this real? Like, how would that play out in a person? And then you see a person experiencing these things, and even though it might be the same condition, whether it's bipolar disorder or depression, is different in every person.
Mm.
It might be the same thing, but it's like, so it's always fascinating. It's always kind of unique in its own way, and you're really trying to figure out what it is that has happened with this person, what they're going through now, and how can I help them? How can I best help this person?
Now, in psychiatry, is this? I guess it depends on the case, but is it certain times that you will you see people for a certain amount of times? Are there some people that you see for lifetimes? Does it just vary depending on?
Yeah, no, that's a good question. One of the questions that I address, particularly in our community, in the Black community, but in general, is when people come to see me, and if I'm going to prescribe a medicine, the first question is, do I have to be on this medicine for the rest of my life? And the answer to that varies a little bit. Say with depression and anxiety, you can treat depression and anxiety without medicine. When it comes to bipolar disorder and schizophrenia and other psychotic disorders, there's really no way to successfully manage those conditions without medicine.
Okay.
And bipolar, and these are the conversations that I'll have up front. When it comes to depression, there are some people who are on an antidepressant for a period of time. All of
Hmm.
the research supports that if you want to treat someone to remission, you want to keep them, we'll say, on their medicines for at least a year. Some studies said, maybe at 9 months, between 9 months and a year, gives you the best chance to treat the symptoms all the way till they go away. And so after that, because that's really the goal, you come to me for help, you want me to take the symptoms away. Once they go away, maybe you don't need the medicine anymore. So at
Hmm.
that point, we'll taper you off the medicines typically, because some of the medicines, your body kind of gets used to them. There's a withdrawal that can happen with some of the medicines. It's not
Hmm.
dangerous. It won't kill you. It's not like you're addicted to some, a street drug or something like that. But again, there is a withdrawal that you go through. So you want to taper the person off. And some people, they're okay for a period of time. Some people
Hmm.
are okay forever. They can go the rest of their life and not have any depression or anxiety. But there are some people who, when you take them off the medicines, the symptoms come back. There may be chronic stressors in their lives, chronic strict triggers that are contributing to their emotional struggles, and the medicine helps them to cope and to kind of not fall apart emotionally while in the face of those stressors. So there are some people who, again, you get them off the medicine, the symptoms come back. It's always a choice, and this I make sure I say this to people. It's always a choice. I've never had to advertise my services. I when I opened my private practice in 2006, the phone rang like 10 minutes after I plugged it in, and I was busy the whole time. So I'm never dragging anyone into my office. People come to me for help, and everything we do is collaborative. It's a choice, particularly with depression and anxiety. And so a lot of people will say, you know what, doc, I really don't want to be on the medicine for the rest of my life, but I don't want to be depressed either. I want to be able to go to
Mm-hmm.
work. I want to be emotionally stable. I want to have successful relationships. I want to live. And so if it takes the medicine for me to do that, well, then fine, I'll take the medicine. And those are the people maybe who may stay on these medicines long term. But and then some people may dip in and out over the course of their lives. They're doing all right for a while, and then something happens again, and they kind of revisit the whole treatment process and get back on medicines. So that's more depression, anxiety, bipolar disorder. It's almost a part. We know some famous examples of people who are struggling with bipolar disorder. They get manic and they kind of melt down, and part of the condition, you're grandiose. You think you have special gifts and powers. And so it's hard to in those states, the person is like, I don't have the problem. I just have a superior mind.
Right, right.
You're the one with the problem. Why are you trying to get me on this medicine? It's almost a part of it that at some point those folks are gonna, if they do agree to take the medicine, they're gonna stop taking it. And what happens is with time, we see the episodes, they come back. So let's say they get better, time passes, they may not get sick next week or next month or even next year, but
Mm.
eventually, with time, the episodes come back. They tend to come back worse. They're more intense. They're more damaging to your life, and the frequency with which they occur continues without medication. So that's why I say for a condition like bipolar disorder, we really can't successfully manage it long term without you being on medicine because you're just going to get sick again.
So
And
can I ask you this while you're there? So for diseases like that, bipolar, schizophrenia, are you born with those things, or that's something you could get, or can it happen both ways?
well, there's a very strong genetic component. So typically,
Okay.
when you ask if someone's born with something, that's what we're thinking about. And
Okay.
the way I would say it is, it appears that some people have a genetic predisposition to those conditions. That doesn't necessarily mean it's going to express, depending, because there's a environmental component. What happens in life, your
Mm.
circumstances, your environment, your physical health, your stressors, all of these things can play into the expression of these kind of illnesses. There's an unknown piece. Why does that young person at 17, 18 years old develop a psychotic disorder? Typically,
Mhm.
they'll be going along fine in life, and then they'll go from an A student to a C student. They'll go from being a very social student to someone who's isolating. These are some of the negative symptoms of schizophrenia that we see. Their thinking will be slow. They'll start smoking cigarettes, using marijuana, because something's going on in their mind. They don't feel right, so they start turning to substances. Again, what makes that person start to experience those symptoms? There's definitely a strong genetic component, but
Mhm.
sometimes it can be some of those environmental factors, and you can have a family where genes aren't distributed equally. So there might be three siblings, and one sibling is the one who struggle with that. You sit down and take a history, you find out maybe one of the parents either had that issue or maybe their sibling had that issue. So you'll find somewhere in the family tree, typically someone else had those issues. And at the same time, someone has to be the first too. So it's not always something that's handed down.
But is it usually always genetic somewhere? Some like, have you ever experienced when there was no genetic
I've
background?
experienced that. You do this long enough, you're going to experience where someone had to be the first.
Okay.
Someone in the family has to be the first, and then there's a variety of things that can cause that. Sometimes exposure. Maybe mom was using substances while pregnant. Oxygen gets cut off to the baby, or there's some toxic exposure in utero while pregnant, and that leads to neurological and psychiatric issues when a person grows up. So that may be the thing that led that person to be the first person, and
Okay.
then this person ends up reproducing with someone who maybe has same or similar issues, which makes it more likely to
Mhm.
to show itself in the next generation. So I've seen it different ways, but typically we're very suspicious when someone has bipolar disorder or schizophrenia. We're very suspicious that a family member may have also had that condition, and it's also helpful because if you identify that family member, you ask, well, what was done for them? Was there a treatment that they received that was successful? And there are a whole host of treatments for all of these conditions, and we really don't know which one is going to work for you. Well, if it worked for someone with shared genetics, maybe it's more likely to work for you. So we use that in doing assessments and picking treatments.
Somebody has a question. Terrence says, "Hey, peoples." Also, somebody in the chat says, "Can a person self-diagnose a mental disorder, or does someone, or does? Can I read today? Or does someone have to tell you?"
Well, so within that question, there are a couple of things that come up. You can tell yourself whatever you want.
True.
Well, and if you're depressed or severely anxious,
Hmm.
you may not need a lot of formal training to figure out you're depressed or you're severely anxious.
Okay.
Um, but when it comes to, um, getting a formal assessment and diagnosis will give you access to treatment options. If you're at work and you need to take time off from work, your job is not going to want to take your word for it. They're going to want you to go to a trained professional who has experience and knows how to diagnose things properly. And I talked at the beginning about some of the years of training that I go through, to become a psychiatrist. That's what we learn. The person who hasn't had all that training, it may be difficult to tell the difference between severe anxiety and psychosis and bipolar disorder and depression. Major depressive disorder and bipolar disorder can look the same because
Mm.
bipolar disorder is mania and depression. And more often than not, when people come into the doctor's office, the first time we see them, they're depressed. So in that moment, how do you know it's bipolar disorder if they're not actively manic? So you learn how to take a history, you learn how to find particular clues, and actually that can impact the treatment.
Mhm.
Sometimes a treatment for depression is, we're picking your mood up. If you have bipolar disorder, you're prone to your mood getting too high, and we don't want to push your mood with the medicine too high. Now we trigger a manic episode.
Okay.
So it's important to kind of know what you're doing when you're getting to the point where you're giving people treatment. But yeah, I mean, part of the benefit of conversations like this is hopefully one of your takeaways will be that you're able to pick up signs, whether it's in yourself or in your significant other, your children, extended family, and friends. We can see when something's wrong with one of our loved ones, and hopefully we're able to engage them and encourage them to seek help. And people are more likely to listen to your friends and your loved ones because we care about you. If some stranger says, this is what's going on with you, you might be a little bit more resistant. But if we're able to pick up on signs, and hopefully we can encourage people to get help sooner rather than later, we can reduce some of the suffering that people go through. Because typically when these things happen, it's very confusing. You feel like it's only happening to you. You don't know
Mhm.
why. There's stigma. So is it some personal flaw or weakness? And if I think it's weakness, well, I don't want to show that. I don't want people to see me in the state. So I'm going to withdraw. And it only gets worse when you do that. So it really is important to try to recognize these things and bring people into treatment.
Okay. And then, I mean, I know you said to engage them, but are there any helpful hints or ways that you can advice you can give people who, if they have a loved one or
Yeah.
close friend that are they recognize it, and maybe the person recognizes it, but is still not willing to seek help? Are there any pointers you can give of to ways to give them a little nudge or a little like maybe
Yeah.
we should try?
Yeah. I think the approach is always very important. You hear it's not what you say, but how you say it.
Mm-hmm.
If you approach people the wrong way and, say, you need to stop acting crazy and you need to go get some help. That's not really helpful.
Not so much.
People are not going to want to hear that. So, approach people and say, look, I'm concerned about you. I've noticed some differences, and maybe laying them out for the person.
Okay.
You're someone who's always really well put together. You're sharp. Your clothes are pressed. You have your hair and nails done. Typically, lately I'm not seeing that in you.
Mm.
You're showing up in public places, and you seem kind of tired. You seem worn out. Your clothes are not what they used to be. We typically maybe hang out once or twice a week. I haven't seen you in a month. You're more sensitive. I notice you're crying easier. What's going on? Engage people in conversation and let them know the reason why you're engaging them is that you're concerned. It's not that you're just trying to be nosy or figure
Mm-hmm.
out what's going on with them, or you're trying to be critical. You really are concerned about this person, and give them the opportunity to speak and to open up to you. Don't try to drag it out of them. Just
Okay.
be present. And one of the biggest things you could do for people who are going through a tough time or a crisis is to be present. And we can feel pressure to say something or say the right thing, and fill those quiet moments with words.
For sure. Yeah.
But just being there does so much for people. It's more than you know. And they'll tell you that when they get over it. Because again, typically people will withdraw. They'll want to isolate. And then all they're left with is their thoughts, and they're ruminating, and the wheels are spinning. They're going over the same things over and over again. They're making it worse in their mind oftentimes than it actually is. So if you're just there, and you're listening, you're not there to fix their problems necessarily. They just want to be heard.
Mm-hmm.
And that's the best first step. If there's a takeaway from this, I'd
Right.
want that to be it. Just be present, to listen, and to offer support. Yeah.
I like that. I like that's very helpful. Thank you for that. Now we
Mhm.
mentioned some of the other more, I don't want to call them popular, but a lot of people are talking more about bipolar and schizophrenia. But I feel like even in my everyday life, a lot of people, and it might be because of all that angst that's going on in the world. But do you find that there's a lot more people that are having some anxiety
Yeah,
issues lately?
for sure. Anxiety, typically, for many years now, anxiety disorders are the most common psychiatric disorders.
Mm-hmm.
Depressive disorders usually number two, and they're more disabling. Worldwide, I haven't checked in a while, but usually depression is in the top five among disabling conditions worldwide, in terms of like missing work, decreased efficiency, and just functionality overall. So, both conditions can be very disabling and impairing, but to some extent, we all deal with some level of
Right.
anxiety. We worry. In psychiatry, we don't want to make everything into an illness or a disease. So there's a certain amount of anxiety that is normal. Performance anxiety is normal. Um, Situational anxiety can be normal. Some common worries, but it's something that needs help when it starts to interfere with your ability to function. And
Okay.
getting back to your question, it's very common for people to seek treatment, um, like in the context of struggling at work. I'm overwhelmed. I'm not thinking clearly. I can't complete tasks. I think I'm not good enough. I think I'm failing. I'm afraid I'm going to lose my job. I got a family, and what's going to happen if I lose my job is like a snowball effect. It can really be damaging to your confidence at work. So oftentimes people will come into treatment saying, "Look, I need some help." The some people do the things that we recommend that are protective, being intentional about sleep, try to get 7 8 hours of sleep a night, be intentional about the energy you allow in your space, keep positive energy, positive people around you, try to
Mhm.
move away from the negativity, try to avoid toxic relationships, be physically active, eat healthy, try to avoid all these sugary processed foods, eat fruits, vegetables, all that. you know you'll hear people say you don't need to see a psychiatrist, you just need to do the things that I just mentioned. Well, yeah, I agree, but people don't do that. That's the problem. and
Yeah.
and when you're in a crisis, that's not the formula for the crisis to resolve quickly. Those are preventative things.
Right.
Now you're here, you're in a crisis, you're not functioning, and you need help. So I see a lot of that in outpatient medicine, that these are higher functioning people because again, they're at work, they have
Mhm.
families, but they're just having a hard time. Sometimes it's very high powered executives who have been doing well for 15, 20 years, and now maybe they're going through a phase of life kind of change, and
Mhm.
not so fulfilled in their job. And we get a little bit older, we don't feel like we can do it like we used to, and so maybe they feel like they're falling off. That's causing anxiety. So those are common things. Depression is situational. It's easy to avoid depression if you avoid stress. Don't get divorced. Don't have a toxic boyfriend or girlfriend. Don't get fired from your job. It's easier said than done. Life happens. Don't
Right.
don't have financial problems. It'd be easy to not be stressed out if you just could avoid financial. Well, it's not so easy for
Right.
everybody. So yeah,
Now, what
that
is
can happen
so
at
now
any
what happens
time.
when it goes from being anxious to like anxiety attacks, which to some people can be debilitating? And speaking of having one myself, and I didn't even know what it was at the time. I really thought something was happening. I was losing my whole mind. Now,
Yeah.
what happens when that happens? Like it feels like you're having a physical thing.
And that's a good place to make that connection between the mind and the body. Psychiatric conditions are not just about what's going on mentally. There are physical complications that happen, and typically an anxiety attack, you get headaches, you get dizzy, your heart's racing, your chest can be pounding, you start sweating, you can feel faint and actually faint. And oftentimes people end up going to the emergency room because they think they're having a heart attack, and it
Mhm.
looks like a heart attack. Um, they do all the tests, and they find out that it's anxiety, and it's really, that is a physical manifestation of what you're struggling with emotionally. That's
Okay.
ultimately what's happening there. And at the end of the day, you got to go in, get an evaluation, be open to addressing the anxiety.
Mhm.
Typically, there's some type of trauma. And not necessarily when you hit trauma, you think of maybe someone who died or was physically abused or something like that. But divorces are traumatic. Losing your job is traumatic. Getting passed over for a promotion is traumatic. Those kind of things, the lights getting cut off because you're buying, or getting evicted from your house. Those kind of things, and these are everyday things that happen, can be very traumatic, and it's on your mind, it's weighing on you, and it can trigger anxiety and anxiety attacks.
And then some people, I've had friends who just have like reoccurring anxiety attacks, and it's not always something that happened. It wasn't the rent wasn't paid or the lights weren't on. Just for some reason, out of nowhere, they have these reoccurring anxiety attacks. I just
What
wonder, is
what I
that
would say,
still probably related to trauma somewhere deep?
it feels they say it came out of nowhere because they're not consciously aware of what it is.
Oh,
It is almost always when you sit down, when that person goes into therapy or they go to
mhm,
see somebody like me, we're trying to figure it out too. Because if you don't know what it is, it's hard to address it and work through it.
huh,
That's typically what happens in the process of therapy and counseling. We're trying to figure out what it is. Denial is a very strong defense mechanism. So we
Hmm.
push things down, we don't deal with things, and it's a way of defending ourselves from the emotions that go along with that particular issue. So you bring it up to the surface, maybe the way you're thinking about it, you can reframe it. Maybe, it's not as bad as you're thinking it is once you talk it through. And through a combination of talk therapy, sometimes medicine, hopefully in the short term, because talk therapy is not going to quickly stop your heart from racing. I can give you a medicine to stop your heart from racing immediately. I can give you a medicine that when you're starting to escalate like that, in 5 minutes, it calms you down so you can think clearly.
Okay.
Um, but yeah, that's typically, what anxiety can look like, and that's the process that we go through to try to help somebody with it.
I'm going to ask some questions in the chat now. Barbara says, what is your opinion of so called self help books about mental health?
I think they're helpful. I think we all should read more. I think what you'll find is you'll find common themes in self-help books. Um, you know, I, we live in an information age, so typically it's not the lack of information that's the issue. It's the lack of implementation of what we should be doing. We on some level we know the things that we should be doing, and that's a lot of what these self helps books are going to tell you how to do. There might be some key, helpful nuggets in there. There may be particular things. Some people rely heavily on their faith, so sometimes there are faith based things that you can take from certain writings and authors. I'm all for that. I'm all for whatever helps. I do think just the process of sitting down and reading through that book, it takes you away from maybe some of your stressors, some of the things you're worried about, some of your focus on your ailments. That alone has a therapeutic impact. And in that moment, you're caring about yourself. We talk a lot about self-care. When you set the time to read a book about something that may be bothering you, that's a form of self-care as well. So I'm all for that. I can't recommend anyone over another, but they can be very helpful to people.
Cool, cool. BK to LA says, over the past few years, I've stayed in therapy beyond the crisis. How common is that?
Well, it's very common, and it's your choice. So you must be getting something out of it. You must find it helpful. I mean, life goes on. And if you develop this therapeutic relationship, which is still the most important thing in working with a therapist, is what we call a therapeutic alliance. When you find someone who you trust and whose advice you value, you may continue on throughout your life seeing them. It doesn't mean you have to see them every week or every 2 weeks or any particular interval. You may kind of dip in and out depending on what's going on in your life. So that's very common.
And Barbara says, how do people respond when they find out you're a psychiatrist?
Um, a variety of responses. People look at me like, like I'm gonna analyze them or something, or they'll joke, say, I really need to talk to you. I got some stuff going on. Early on,
Mm-hmm.
I hadn't thought about this in a while, but I think people have an image of what a psychiatrist looks like. Maybe a older
Mm-hmm.
white man with a beard and then smoking a pipe. I don't know if that's still the impression, but I was trained by some people who look like that, so I understood. But I think there are more people who look like me who are doing this kind of work. And yeah, no, I think we've come a long way when it comes to mental health treatment and stigma. I think there was a time maybe 15, 20 years ago when I started where people were less comfortable even coming to see me.
Mm-hmm.
And utilization, people going to see the psychiatrist or therapist since the pandemic has gone way up. And that's a positive thing.
Cool, cool. Then we talked about some other things, but I have quite a few friends, so I hear people now, even in playing and conversations, talking about ADHD. Now, can you tell me first, what's the difference between adult ADHD and just ADHD, or is there a difference? I don't know. Is
There
it
is.
just?
It's the same thing. It used to be called attention deficit disorder. And then we updated it to attention deficit hyperactivity disorder. and there are different types. There's an inattentive type and the hyperactive type. Typically it was the young girls in school, maybe more distractible. They got the inattentive type, and the boys who were running around the classrooms, tearing the place up, getting into fights. They got the hyperactive type. I think historically we thought that this was a disease of childhood, or a disorder, I should say, of childhood, and then everybody would grow it out. But the reality was people continued into adulthood with these issues with organization, poor organizational skills, distractibility, impulsivity, difficulty completing tasks. You're more likely to have relationship issues and maybe get into high risk behaviors like substance use because of ADHD. So, we realize this is something that we should continue to manage and treat into adulthood. People are sensitive about. There were a lot of meds prescribed, particularly to kids, when it comes to ADHD, and so I think people are right to become a bit hypersensitive to the idea of prescribing kids medicines. That's understandable. At the same time, medicines help a lot of people. There are non-medication interventions, keeping lists, making sure you get enough sleep, dietary changes. We definitely see there's a connection between sugar and some of the things we see with ADHD. It takes a lot of being intentional outside of the medicine to overcome those symptoms, but your symptoms make it harder for you to do that. So it's easy to say, well, just be more organized, but that's my problem. That's my problem. I can't remember nothing. I keep forgetting everything. I keep losing my keys, and my bills are past due because I can't remember. I don't have a spreadsheet. So there are treatments that are available. There's stimulants like Adderall, Concerta. That's a very common thing over the years, that adults would come to me because they were having trouble either, going back to school. We tried to be careful with the college age kids. They start giving them out like candy and misusing them. But adults who are working and had job jeopardy and other issues, it became common for them to come in and seek treatment. The stimulants are controlled substances. So if you just walk into a doctor's office today at 30 plus years old and say, I've never been diagnosed with ADHD, but I'm having trouble concentrating, I think I got ADHD, can I have some medicine? The answer is probably going to be no. Or what we'll want to do is prescribe a non-controlled medicine, a non-stimulant. Adderall, Concerta, Ritalin, those are controlled medicines. The DEA frowns upon those being given out like candy, especially in the context of the opioid crisis. But there are medicines like Strattera. The generic is atomoxetine. It has a similar mechanism of action to like Prozac and Zoloft. There's a newer medicine called Quellbri. So, Wellbutrin's an antidepressant that people find helpful with ADHD symptoms. So, there are options. There are a lot of different options.
Oh, okay. The Instagram is a little slow. I thought it went mute again, but it didn't. Oh,
Okay.
Katora says, speaking of ADHD, have you seen discourse connecting gifted and talented programs for kids to adult diagnosed ADHD or even ASD? I've been seeing convos about that on social media.
I can't speak to a connection between talented and gifted programs and ADHD. I don't know if the question is my child more likely to struggle with ADHD or an autism spectrum disorder if I'm in those programs? I'm not aware of any research around that. I know kids in those programs, they have some of the same issues as everybody else. Autism spectrum disorder diagnoses have exploded in past couple of decades, and it's not that autism spectrum disorders didn't exist in the 80s. We weren't looking for it, and we didn't know how to recognize it. We all can look at someone without any training and say something's wrong socially over there. Something's different. That person, is, now we use the term neurodivergent.
Right.
Not necessarily a bad thing, but you see something that's going on there that's different. and we need to kind of bring this. We need to be mindful of that and see what we can do to kind of bring this person into the mainstream instead of kind of pushing them to the side. So I don't know if I fully answered that question, but I don't see that connection that was suggested. But I know, whether you're talented and gifted or not, those same issues can occur, and we have to be mindful of getting proper assessments, because that's the gateway to getting treatment and access to services, particularly in the school system when it comes to autism spectrum disorders. Sometimes the public school systems are not well funded. They will fight you when you try to get them to get certain educational assessments. I've treated many moms over the years. I really felt bad for them, because you could tell they had to really mount a fight against the school system to get the services that their child rightfully deserved. But yeah, getting the proper assessments, that opens the gateway to different treatment options.
Wow, wow. So I mentioned earlier I was going to ask you, like, do you have any success stories or a success story you'd like to share, or you can share?
You know,
Maybe.
when I was in med school, I always remember one of the surgical residents like, why would you go into psychiatry? Nobody gets any better, which was
Oh,
kind of a silly. He was silly, and I've forgotten, but it's kind of a silly way of looking at things. It's like people, obesity, diabetes, heart disease. These are chronic conditions. You don't necessarily cure them. If you want to cure stuff, be an orthopedic surgeon. When I break my arm, put me in a cast, fix my arm. All right, you fix something, okay? But wait, I lost my train of thought. What was what was the question
I
again?
was asking about like any success stories, and you
So
started off when you were.
in terms of success stories, over the years there have been plenty of situations where people were really bad off when they came in, and by the time they were a different person. Like, during my training in the hospital, there are a couple of cases I remember. A young lady particularly was very manic. Um, she had her first manic episode at 16,
Mhm.
had a suicide attempt,
Mm.
derailed her academically, but she got back on track. She got treatment, got back on track, and then a year later, she stopped all meds. Then a couple years go by, and she's fine. Now she's back in the hospital. She's in a relationship. She's screaming at her. It was really bad. She was aggressive. She was kind of lashing out at everybody, But by the time we were done, we got her back stable on the medicines. Oftentimes, people will express some thanks and gratitude, even though these same people were cussing you out and yelling at you and saying, "Let me out of here." That's an experience you'll see a lot in the hospital. I think it was gratifying. There was one patient I had when I was at Fulton County's Department of Behavioral Health. And, that is a place where you treat people who don't have resources. And it's for what we call indigent patients. Half the patients didn't have any insurance. The
Okay.
other half had a combination of Medicaid or Medicare. So you're treating people who maybe have to take multiple buses just to get to the clinic. Um, and sometimes you book 25 people in a day because half the time people don't show up. And every once in a while, everybody would show up. And I made a point of going out to the lobby and saying, everybody, I know you're here. I value your time. I respect your time. But everybody showed up today. So I'm going to get to you. You just have to bear with me a little bit. And there was a woman who I took like an hour with her. I looked through her history. I looked at the diagnoses that were in place and the medicines. I made a lot of changes and really explained to her what I was doing. And she wrote a long letter to like the health director and was very grateful about how she saw how busy it was and how I took the time to spend time with her and how I talked to everybody that was there. It's, and over the years, I've had people who I hadn't seen in 10 years send me a message and say, hey, Dr. Sims, I saw you back then. I'm doing much better now. So those kind of things are particularly gratifying. But there's so much going through my head. People who are very psychotic and ECT. I figure I'll mention electroconvulsive therapy It is
Mhm.
not like it is in One Flew Over the Cuckoo's Nest, where they're strapping you down.
Right. That's the
It is.
first
It
visual
is.
I have. Yes.
It is. Sadly, many years, 50 years later, that is people still first visual,
That's
but
right.
it's a medical procedure. There's an anesthesiologist. We induce seizures to a particular part of the brain. This is not the first thing you're going to get offered if you're struggling. There are people who really have a hard
Mhm.
time after multiple standard treatments. They are still struggling with very severe symptoms. And so there are a couple of treatments that are kind of the end of the road. They work really well, but we save them because there are risks involved in side effects. So those are just
Correct.
some things that come to mind. Again, I always feel good when someone says, you've helped me. People get better. It just came to mind a woman who she was having trouble at work. She was out for a couple of months on FMLA. Typically, people will come and ask you to help with paperwork. She used her EAP benefits,
Mhm.
employee assistance program benefits. That's another thing for those who are listening. Your job is invested in having workers who are emotionally stable who can produce at work. So there are benefits typically to help you when you have struggles. And oftentimes with EAP, it's no cost for maybe a period of time. Uh,
Yes.
so all those things come to mind. People do get better. There are some people who have very severe disabling conditions, severe schizophrenia, chronic psychosis. Cognitively, they end up kind of going downhill and really live a life where they're dependent on the community. They're not as, we try to have them as independent as possible, but there are those stories as well. And you just do the best you can to help people as best you can.
So that makes me think, well, all these are some like intense stories and intense situations you have to deal with. How do you manage all of that stuff during the course of a day or weeks or months or however long it is at a time to be able to
Yeah.
disengage and be your non-doctor Sultan himself?
Yeah, no, I don't think psychiatry or the mental health field, I don't think it's for everybody.
Mhm.
I don't think it's for, we all want to have some empathy and compassion, but I'm built in a way that when I'm at work and when I'm helping someone, I'm giving it my all. And I'm able, once I've done that, I'm able to go home and say, "Hey, I did my best for that person." I don't carry this stuff with me. There will be things that you think about, say, "Man, that was a really messed up case," or I really feel bad for that person. But no, I happen to be the kind of person who, I feel I can look in the mirror and say I did my best. And as long as you're able to do that, I don't worry about things that I can't control. Life
Mhm.
life
It's
is
big.
not fair. Life is not fair. These type of issues are not distributed equally. You
Mm.
know, and I've dealt with a lot of it. Not only do these conditions affect the person, but the family. Particularly the more disabling positions. I spent a lot of time talking to mom and dad and talking them through things, and so um, yeah, I'm able to. I do a pretty good job. I have a full life outside of what I do. I'm able to separate things, but to me, it's really about kind of helping as much as I can and feeling good about that.
That is dope. How did you know that about yourself? How did you find your mojo in knowing you wanted to become a psychiatrist?
Um, I would say, I think it fit my personality. Um, First, I was stimulated intellectually by what I was doing.
Okay.
But
Big.
I knew I wanted a particular kind of life, and psychiatry offered me certain flexibility. There are a lot of things you can do within psychiatry, so I wasn't pigeonholed into one thing that can get stale, and then intellectually you might get bored. I knew I wanted to have a family. I wanted to be able to go home. I didn't want to be in a hospital all hours of the night.
Okay.
No one calls me at 2 in the morning. My pager's not going off. I haven't had a pager since I left training. So certain things, like if I get stabbed in the middle of the night or shot, Hopefully, there's a surgeon over there at Grady Hospital in Atlanta to patch me up, but it's not going to be me. I don't call me at. I just don't work like that. I would not be a nice person if I had to get up at 4 or 5 in the morning every day. So you got to know yourself, and you have to do kind of do have a path in your life that aligns with who you are. So that's how I ended up in psychiatry. It was the best decision ever. I'm very happy. I love being a psychiatrist, and so
I
I think
love that.
I found my little niche.
I love it.
Mhm.
So if people want to reach out to you, what's the best way they can do that? They're looking for psychiatrists of their own.
Well, I'm not taking patients at this time. So if someone has a question, I would say, since I've been introduced to them through your platform, if they reach out to you, you got my information. If I had a private practice or something, I would give you, my number to my private practice. But any work I do at this point is through another platform, and so I'm not actively taking patients now, but I do spend a lot of time answering questions. We didn't talk much about navigating the healthcare system.
That's
It is
okay.
it's very difficult. You know, if you have insurance and an issue arises, most people don't think to call the insurance company, but call the insurance company. There are nurses and doctors at the insurance company who can help you navigate things. They can identify healthcare providers at different levels, therapists, physicians, and in between. And when you have insurance, you want people in your network as opposed to out of your network because the costs are different. If you end up on medicines, you're gonna need to know about copays and all those kind of things. Sometimes you look up, you can Google anybody and you can find somebody's practice information. But commonly you'll hear, well, I called 5 different people. They didn't answer the phone. I left a message, they didn't call me back. I can't get
Mm-hmm.
in for a patient for 2 months. You'll have a variety of things that are very frustrating, particularly when you're having a hard time or you're in a crisis. So whether it's your insurance, if you have insurance, is always a place to start. They're there to have a network of healthcare providers to take care of you when something goes wrong.
Mm-hmm.
So yeah, no, that's where I would tell people to start. Psychiatry is not in a place where a lot of my colleagues have like solo private practices. So people, be like, Doc, somebody, I know someone in Virginia or New York, anybody who has a practice in those places. Not really. Many of us work doing different things. Not many of us have our own private practice. Some do. But you're better off. Psychology today is a resource when it comes to therapy. They list a lot of psychologists and social workers and licensed professional counselors, and they list their practice information. So that's a resource, Psychology Today. But yeah, if you have insurance benefits, I'd start there. Every state has a safety net system. So for those who have insurance, you should have access to healthcare providers who accept your insurance. For the uninsured, there is a network of community mental health centers, and they're there to treat people regardless of ability to pay. I worked at one for my first 10 years here in Fulton County's Department of Behavioral Health and Developmental Disabilities. We call them community service boards in Georgia, or CSBs, but they're essentially community mental health centers. So that's another resource for those who may not have access to insurance. But if you have Medicaid, if you have commercial private insurance, if you have a federal employee program, if you have Medicare, start with your insurance if you need help.
Thank you for that. And before, when we were kind of pre talking about our conversation today, you also mentioned, or we said that we should try to give people, you did along the way, give people some helpful hints, especially with a lot of the stresses that are going on in the world, the country today. Are there any last minute tips or advice you can give people just to manage? They might not necessarily be having a crisis, but just, having some feelings of overwhelm or can't go no further. Anything you can tell them they can do in the midst of the madness?
Yeah, number one, don't isolate yourself. Reach out to somebody you trust and try to talk to them. Let them know what you're going through. Seek support, seek help. Going back to those things I talked about, be intentional about sleep, about removing the noise and the negativity, especially when you're not feeling well. That is not the time to deal with nonsense. I cannot deal with this mess right now. I'm not well. I need to take some time for myself. You got PT. If you work and you got paid time off, take the paid time off. That's what it's there for. Sometimes we need to recharge. So the we should not be surprised if we poison ourselves that we later on get sick. Don't eat poison and be surprised when you get sick. Our
Mm-hmm.
food supply, and that's not a soapbox I'm gonna take. We're almost at the end, so I won't get on the soapbox. But being intentional about eating healthy um, will go farther than many treatments can go for you. It's a longer term thing. In a crisis, eating healthy tomorrow is not going to fix your problems, but building a life where you eat less sugar, less starches, more proteins, more fruits and vegetables, more home cooked meals. Sleep, again, one of the biggest risk factors for obesity is lack of sleep. You know, sleep, a lack of sleep wreaks havoc on our body, keeping stress to a minimum. Cortisol is a stress hormone. Stress goes up, cortisol gets released. It wreaks havoc on you emotionally and physically. So those are the things. But ultimately, seek help when you're having a hard time. It is not just you. That's what it's going to feel like. Why is this happening to me? You are not alone. Whatever you're going through, many, many other people have gone through. And so don't feel ashamed to ask for help. And with asking for help, you will get better.
Well, thank you. That was really, I don't know if that was helpful for you, but that definitely helped me put things in perspective too,
Yeah.
for sure, for sure.
Life is short. We're not getting younger. And just,
That
work
for sure.
hard, play hard, enjoy your life, put in the work and, don't wait until retirement to enjoy your life. Too often when people do that, they retire and before you know it, they're not here anymore. And they miss that opportunity. Remember what the money is for. The money is for, the basics. And then beyond that, to enjoy life.
Right.
Don't keep putting, if you want to do something for your mental health, do things to enjoy your life now, especially as you get older. Don't keep waiting.
I couldn't agree with you more. Thank you for dropping those gems. And that's such a great way to conclude the conversation. So I appreciate you. I hope to have you on again soon.
Yeah.
Terrence told us we could have a whole talk just about insurance alone. So,
Yeah. We sure can.
right. But I thank you so much for those gems. I learned a little something, even if you all didn't. But I feel like all of the comments in the thread seems like we're talking about the right thing. So I
Okay, good.
appreciate you. I hope you have a good rest of your night, week, and enjoy your upcoming trip.
All right. I'm glad we did it. Thanks,
Yes,
everybody.
yes, me
Thank you.
too. Thank you. I'm so glad we're finally able to connect. And everybody who's watching next Monday at 8 p.m., we're going to be talking to a friend of mine, Zamia, who's going to tell us a little bit about her work at the Isaiah House here in lovely East Orange, New Jersey. So stay tuned for that next Monday at 8 p.m. Everybody have a good night. Cheers again. Take care.
Cheers.